is here, and I'm going to ask Mr. Davis to go next.
Thank you, Mr. Chair. Minister, of course, unfortunately, we know that opioid deaths have gone up in Canada every year of your government so far. Hopefully that's not the case this year, but it's been the case. And you mentioned that stigma is a significant reason for people not getting the treatment they need, and no doubt stigma is an issue that needs to be dealt with. But the evidence that we've heard at this committee, whether it's through our opioid study or pharmacare or any other one, is that there's a profound lack of access in this country to timely, affordable, appropriate treatment. And I mean, we heard testimony just this week from an Ontario treatment center that deals with children, like 13 to 18-year-olds, where their wait list is over 12 months. And we hear this stark testimony that when someone's ready to get treatment, you must get them into treatment immediately. You can't even wait a day, or you're risking a death sentence. Now, you've mentioned $150 million, which I applaud the government for, but if you divide that by 13 provinces and territories, that works out to about $12 million per year, or per province or territory, if you distributed it equally. So there seems to be a consensus among people in the addictions field that we need to rapidly expand and significantly increase new dollars for treatment if we're really going to start tackling this. Do you agree with that?
Well, I certainly agree that treatment is needed when people wanting to get the help that they need. They certainly want to get the treatment in a timely fashion. With respect to the initial investments that we've made this year of $150 million, it is to provide additional services and support to provinces and territories. We also have to look at the $6 billion that we've invested in mental health services as well. We can't forget that bilateral agreement has been signed, and those monies as well also address the issue of mental health and substance use issues. Our government will continue to work with provinces and territories, as we certainly recognize that treatment is an area where more needs to be done. But also we have to recognize that making sure that people can receive the treatments that they need when they need them, and we have to reach the clients where they're at. I mean, sometimes we feel it may be a treatment model, but for some individuals it could be an overdose prevention site. We need to make sure that we reach the clients where they're at. That's good to
hear, and I would just encourage as much money as possible into treatment. Now, last election, the Liberal Party promised to end the discriminatory and unscientific policy that prevents men who have sex with men from donating blood. Instead, your government has just reduced the abstinence period from 5 years to 1, in my view, simply perpetuating the discrimination but reducing the quantum. Now, why is your government refusing to end what the LGBTQ2 community and scientists across this country, regard as a blatantly discriminatory policy, and instead adopt one that is based on science and behavior as opposed to a discriminatory assumption?
Well, I think you're probably aware that Health Canada is the regulator, and we are not the ones that ultimately can tell Canada Blood Services what they do. Canada Blood Services has
reduced... Didn't you reduce it from 5 to 1?
Canada Blood Services has made an application to reduce the deferral period from 5 years to 1 year. They brought that application to Health Canada. It was reviewed, and then from there we agreed. We have been advised that they are going to be in the process very soon of coming forward again to reducing the deferral period again from 1 year to 3 months. As soon as we receive that application, Health Canada will once again do the assessment, and then from there determine if it's going to be approved. But at the end of the day, we have to keep in mind that it's Canadian Blood Services that makes the application to us, and we don't tell them what to do.
Fair enough. But with respect, Minister, I think the government does have the authority to act on it if they wanted to. My last question has got to be a quick one on vaping product promotion. We heard recently that Imperial Tobacco is openly flaunting the federal rules, and they're running lifestyle ads for Vape EpiPen 3 on television and social media and elsewhere. And despite complaints to your ministry, no action has been taken. Minister, why is your ministry allowing Imperial Tobacco Canada to break the law and have lifestyle advertising on vaping pens when that's clearly against the law?
Well, Mr. Davies, I have to say that I'm very proud of our smoking strategy, our anti-smoking strategy that we've brought forward this year. We've made significant investments when it comes to plain packaging, when it comes to smoking, and we've also made sure that we've made significant changes in that area. Even when it comes to smoking, and then I'll get into vaping, the Canadian Cancer Society have indicated that the regulations and the plain packaging that we are bringing forward is actually the best that they've seen in the world. So we are certainly tackling this head on. When it comes to vaping products as well, we've made several recommendations and changes there as well, and we are restricting vaping, marketing for vaping products. We will continue to monitor this situation, and we are very proud of the work that we've done in order to ensure that this industry is regulated and that we do all that we can to ensure that no marketing practices are allowed.
Okay, Madam Minister, I think you better check the clock. It might be time for you to go. Thank you, everybody, for your